Hi everyone, and welcome back to Sketch Plastic Surgery YouTube channel. Breast augmentation is one of the most performed cosmetic surgeries in our clinic. Most of our patients who choose breast surgery do include improved self-esteem and body image, even though the reasons for having the procedure vary. Today, we're going to walk you through what a new patient surgery and preparations for a breast augmentation look like at Sketch Clinic.
We'll get you into the surgery gown first. So at the top, you will need to put this gown on, and at the bottom, there is a skirt that you can wear to be a bit more comfortable. And once you've washed your face, please do not apply anything.
Okay, thank you.
Before we continue, check out sketchplasticsurgeryen.com after watching this video for more information.
So after the surgery, you can experience some bleeding and bruising, which is very normal. And then, of course, there are some potential risks of infection and inflammation. So in order to avoid this, we'll provide you with prescription medication to take afterwards. So make sure to take them as indicated, all right? With breast implants, there is a risk of the implant rupturing. Of course, it's quite rare, but in case that happens, because of the texture, like the silicone that is used, you won't quite know whether it's ruptured or not. So we do advise you to get ultrasound tests done once a year to make sure that the condition of the implant is good. Just understand that there are limits as to what we can achieve with surgery. We'll try to give you the results that you're looking for in terms of enhancement, but also try to match the symmetry as much as possible.
네, 안녕하세요. 어떤 이유로 수술을 원하시는지 먼저 좀 들어보고 싶습니다.
So the reason why I want surgery is because I don't feel confident with my breast, and it's been for some time. The size is okay, technically, like it's not a small size, but the form and also the asymmetry that I have was of concern. And at some point, I would notice that I would just cover my breast with my hands. And when I looked in the mirror, seeing me doing that, I realized, oh my God, I'm not happy with my breasts, and I'm not happy with how it looks like. And I know I can change other physical things with fitness and gym and trying to eat healthy, but I know with the form and how my breasts look now, it's not changeable just by myself. That's why I want to have the surgery.
오케이, 알겠습니다. 사이즈는 이제 적당하다고 이제 이야기를 하셨는데 조금 이따가 일단 그 쉐입이랑 사이즈를 한번 확인을 해보고 저희가 이제 수술 후에 얻을 수 있는 모양을 이제 시뮬레이션 할 수 있는 그런 도구를 이용해서 좀 보여드리면 이제 어떤 모습을 원하시는지 저희가 더 확인할 수 있겠네요. 보형물 회사에서도 이제 여러 가지 그 그레이드의 보형물들이 있고요. 그 중에서 뭐 멘토사의 어떤 이제 하이 레벨 보형물 그리고 모티바사의 하이 레벨 보형물들이 있죠. 그 두 가지 중에 이제 하나를 선택을 하신 거고, 뭐 지금 보시는 거는 이제 비슷한 사이즈의 보형물이고 겉의 질감이 조금 다르긴 합니다만 크게 차이는 없습니다.
Okay, cool. Thank you.
네.
The surgeon has prepared two sets of sizes for you to try on. I know that you were worried about this sagging as well, and you felt like you needed a lifting.
Yes.
But in your case, since we're going to go a bit bigger in size, just inserting the implant is going to be enough to correct that kind of sagging that you see at the moment, because we're going to add quite a bit of volume, so you'll have a more uniform volume at the top and at the bottom as well.
That would be really great.
This one is the smaller size.
This is the smaller size?
Yeah, so this one is 425 cc's, and then the bigger size is 475 cc's.
Yeah, the bigger one?
Sure.
Yeah, I like this more because my concern is opening up this area to get less saggy looking breasts, which was also one of those things that made me unconscious.
The surgeon confirmed that going with the bigger size is more suitable in your case, just because of your measurements and your body frame overall, and also by adding more volume, we'll be able to treat that sagginess that you're concerned
Yeah,
about.
thank you so much.
네,
감사합니다.
감사합니다.
Alright, we're ready for your surgery. We'll go into the operation room.
Once in the operating room, the anesthesiologist gives the patient general anesthesia, which is given through a breathing mask, and then monitors vital signs and adjusts anesthetic throughout the surgery. Afterwards, following the previously made marks, Dr. Jung makes an incision 3 to 4 centimeters long below the natural fold of the breasts. Then, with the electrocautery device, the surgeon separates the fat from the muscle to create a pocket where the implant is placed. Once the implant is inside, the surgeon uses his hands to place the implant in the correct position, and then the incision is closed with sutures. After surgery, the patient may be able to return to work in a week or two, depending on how physically demanding work is.
How are you feeling right now?
I'm a little bit dizzy, but I'm
have you rest a little bit more before you can go. And in the meantime, I'll explain to you how to take your medication. So we have here your precautions for after surgery. So if you have any doubts, you can read through that. But of course, you can always reach out to us if you have additional questions.
Thank you so much. It was really good that you were there when I woke up because I was like, oh my gosh, and then a familiar face and made me so much more calm.
Yeah, I'm glad to hear that.
It has been 1 month since the surgery. How are you feeling?
So much better. Now I feel like I can do almost everything. Of course, you can still not use like heavy weight. Like heavy weightlifting is not still okay to do so, but anything else, totally fine and so much more comfortable and definitely an improvement.
What was the hardest part of the recovery in this first
Sleeping,
month?
the sleeping comfort, but besides of that, also not being able to use your full strength. But it's back from time to time, so it's okay. Like now, I would not find anything to complain about, I'd say.
So we already saw that the swelling went down. Now we just are waiting to see the doctor and let's hear what he has to say. But overall, the recovery is going smoothly and we're very happy to see that.
Is there any situation, pain, upper back?
When I stand for a longer day, and then that's where I get the pain usually. Not really anywhere else, but it's always the same area where I have pain.
Have you experienced strenuous exercise?
Maybe a little bit.
Little bit?
Yeah, maybe a little bit.
그럴 수 있겠- Yeah, let me check.
Yeah.
So when the doctor touches this area,
I
how do
can
you
feel less here and more here, but that's about that.
Okay.
Here it was more sensitive, like hurts. Here not pain.
This is completely fine, so no need to worry about this.
Right.
So because of muscle movement, there's some sensation. So doctor recommends to wear sports bra, especially when you do exercising, because that prevents some like excessive movement for your breast.
Do I need like a tighter sports bra?
So when you do some running exercises, better to wear like more tighter one.
Okay, so something tighter than
Something
when,
tighter,
when I
yes,
work out
for running.
specifically.
So that's just the basic precautions you need to follow for 2 months, just to prevent some unnecessary movement for your silicone implant.
Okay, no more questions. Thank you so much, doctor.
Welcome.